Let's talk about dengue. We're going on a journey from something as small as a single mosquito bite all the way to a massive national health challenge. And for any of you studying community medicine here in India, understanding this entire path from bite to battle is absolutely critical.
You know, this really hits home. This quote captures that personal side of the struggle, that feeling of anxiety when the monsoon season starts. Well, it's a reality for so many of us. It's a powerful reminder that public health isn't just about statistics. It's deeply, deeply personal. So, this brings us to the big question we're going to tackle. How does that one bite, that one event, spiral into a nationwide crisis that puts our entire healthcare system to the test year after year? Let's break it all down.
Okay, first things first, we need to get to know the main players in this story. We're talking about the virus itself, the mosquito that acts as its getaway driver, and exactly how that whole transmission cycle works. This is really the foundation of dengue epidemiology.
So the dengue virus isn't just one thing. It's actually a family of 4 distinct types, or serotypes. Now, if you get infected with one of them, let's say DENV1, you're immune to it for life. Great, but here's the catch. Your immunity to the other 3 types is only temporary. And this is a super important point, because it sets the stage for some really serious problems down the line.
And here is our culprit, the Aedes mosquito. In India, the main troublemaker is Aedes aegypti, and it is perfectly adapted to live right alongside us. It just loves breeding in clean, stagnant water, the kind you find in desert coolers, flower pots, you name it. It's a daytime feeder, which is kind of sneaky. And get this, its eggs are incredibly tough. They can survive for more than a year in dry conditions, just waiting for a little bit of water. This makes controlling them a massive year-round challenge.
Okay, so the bite has happened. The virus is in. Now we're going to dive into the intense battle that unfolds inside the human body. For you, as future doctors, really understanding this pathophysiology is the key to spotting and managing severe dengue before it's too late.
And this brings us to a concept that is absolutely critical: antibody-dependent enhancement, or ADE. Remember how getting one serotype only gives you partial protection from the others? Well, if you later get infected with a different serotype, your old antibodies, they can't stop the new virus. In fact, they do the opposite. They can act like a Trojan horse, grabbing onto the new virus and helping it sneak into your cells way more easily. This is the very mechanism that can turn a second dengue infection from a bad flu into a life-threatening illness.
So, with this enhanced viral replication, the immune system just freaks out. It unleashes what we call a cytokine storm. It's this massive, uncontrolled flood of inflammatory molecules that, instead of helping, cause widespread damage. And this is what leads to the classic sign of severe dengue: plasma leaking out of your blood vessels. That leakage is what can cause shock, organ damage, and all the other severe complications.
This slide is just brilliant because it shows you the difference between 2 major viral diseases you're definitely going to see. With dengue, the main problem is leaky blood vessels, which leads to bleeding. But in severe COVID-19, it's more about damage to the lining of those vessels, which leads to clotting. Completely different problems. Understanding this distinction is absolutely vital for making the right call, especially if you ever have a patient with both.
All right, so we've got the science down. Now, let's talk about what this actually looks like in a patient. Knowing the clinical phases, and more importantly, knowing the warning signs, that knowledge can literally save lives.
Dengue usually moves through 3 phases. First up is the febrile phase: high fever, horrible body aches, the classic breakbone fever. But the most dangerous time is actually the critical phase, which starts right when the fever begins to drop. This is so deceptive. The patient, and maybe even you, might think the worst is over, but nope. This is exactly when that dangerous plasma leakage can start. Finally, with good management, the patient moves into the recovery phase.
These right here, these are the red flags you absolutely have to watch for. If your patient starts complaining of severe stomach pain, can't stop vomiting, or shows any signs of bleeding, they need to be in a hospital right now. And on the lab side, a rising hematocrit with a plunging platelet count is the classic signal that your patient is entering that dangerous critical phase. So, you've seen the signs. How do we build a solid management strategy from here? Let's look at how we confirm the diagnosis and use that information to treat our patients effectively.
Okay, on the diagnostic front, we're moving beyond just looking at the platelet count. There's something called the immature platelet fraction, or IPF. Think of it this way.
A rising IPF tells you that the bone marrow, the platelet factory, is back online and starting to produce new platelets. It can predict recovery a couple of days before the platelet count actually starts to go up. Why is this so valuable? Because it gives you the confidence to hold off on unnecessary platelet transfusions, which, let's be real, come with their own risks.
So management is all about smart triage, following the WHO guidelines. It boils down to 3 groups. Group A, these patients are stable, no warning signs, they can be managed at home with lots of fluids. Group B, these are the patients with warning signs, they need a hospital bed and supportive care. And then you have Group C. These patients are in severe dengue with shock or major bleeding. They need emergency treatment in the ICU.
Now, let's zoom out, because treating individual patients is one half of the battle. The other half is fought on the public health frontline. And this is really where community medicine shines.
And the scale of this fight is just immense. Just look at that number. In 2023 alone, India officially reported nearly 300,000 cases. This shows you why dengue isn't just a clinical problem for one doctor, it's a massive public health challenge for the entire country.
And you can see a clear pattern here. Every single year, like clockwork, right after the monsoon rains, cases spike. This is directly tied to all that rainwater, creating perfect breeding spots for mosquitoes. The predictability is actually a good thing, though, because it allows public health systems to prepare, to ramp up vector control, and to get awareness campaigns going.
This is also super interesting. It shows how the dominant serotypes are always shifting. In this study from Western UP, DENV2 was the main one circulating. Now, why do we care? Because we know that some serotypes, and DNV2 is a big one, are often linked to more severe disease and bigger outbreaks. This kind of surveillance is like an early warning system for how bad a dengue season might get.
So given this huge, complex challenge, how does India as a nation fight back? Let's take a look at the national strategy and some of the incredible progress that's been made.
The whole effort is led by the National Center for Vector-Borne Diseases Control, or NCVBDC. This is the main agency that coordinates pretty much everything, from the big vector control programs and surveillance systems down to the clinical guidelines that you'll be using on the wards.
And this number right here, this is a testament to the success of that strategy. Even though the number of cases has gone up over the years, India has managed to slash the case fatality rate to less than 0.1%. That is a massive public health victory. It means we're getting so much better at early diagnosis and effective management, and we're saving more lives.
And that brings us to our final thought. We've gone from the microscopic level of the virus all the way up to national policy. So the question for you is this: as you move out of the classroom and into the clinic, how will you be that link? How will you use what you learn from the patient right in front of you to contribute to that larger public health battle against diseases like dengue? It's something to think about.